topic of vaccines has become a highly debated and contentious issue in recent years, with many individuals questioning the safety and efficacy of these medical interventions. One of the primary reasons for this skepticism is the widespread perception that the mainstream media lies about vaccines. While some may view this notion as a conspiracy theory, it is essential to examine the available evidence and consider the potential consequences of blindly trusting the media's narrative on this issue. First and foremost, it is crucial to recognize that the mainstream media has a long history of disseminating misinformation and propaganda on various topics, including vaccines. This can be attributed to several factors such as the influence of corporate interests, government agendas, and the pressure to generate revenue through advertising. As a result, many media outlets have been caught presenting biased or inaccurate information, often in the form of editorials or sponsored content that masquerades as legitimate news. One notable example of the media's propensity for deception is the 1998 Lancet study, which sparked a global controversy over the alleged link between the measles, mumps, and rubella MMR vaccine and autism. Although the study was later retracted due to methodological flaws and ethical concerns, the media's initial coverage of the story helped to fuel widespread panic and mistrust of vaccines. Subsequent investigations have revealed that the study's lead author, Andrew Wakefield, had significant conflicts of interest and had manipulated data to support his claims. Despite this, many media outlets continued to promote the myth of a vaccine-autism link even after the study's retraction. Furthermore, the media's coverage of vaccine-related issues often relies on sensationalism and emotional appeals, rather than objective facts and scientific evidence. This can be seen in the way that vaccine injury stories are typically presented, or the focus on anecdotal accounts and heart-wrenching personal narratives rather than rigorous scientific analysis. While it is essential to acknowledge the experiences of individuals who have suffered adverse reactions to vaccines, it is equally important to consider the broader context and the overwhelming scientific consensus on vaccine safety and efficacy. In addition to the media's biases and inaccuracies, there are also concerns about the role of pharmaceutical companies in shaping the narrative on vaccines. The vaccine industry is a multi-billion-dollar market, with many companies investing heavily in marketing and lobbying efforts to promote their products. This can lead to a lack of transparency and accountability, as well as the suppression of critical information that may undermine the industry's interests. For instance, documents released through Freedom of Information Act requests have revealed that pharmaceutical companies have engaged in secretive dealings with government agencies and media outlets to promote their vaccines and discredit critics. The importance of knowing that the mainstream media lies about vaccines cannot be overstated. By blindly trusting the media's narrative, individuals may be putting themselves and their loved ones at risk of serious harm. Vaccines are a critical component of public health policy, and it is essential to approach this topic with a critical and nuanced perspective. Rather than relying on sensationalized media reports or simplistic soundbites, individuals should seek out credible sources of information, such as peer-reviewed scientific studies and reputable healthcare organizations. Ultimately, the media's lies about vaccines are a symptom of a broader problem of lack of transparency, accountability, and critical thinking in our society. By recognizing the media's biases and inaccuracies, we can begin to build a more informed and discerning public, one that is capable of making informed decisions about its health and well-being. It is only through this process of critical evaluation and scrutiny that we can hope to uncover the truth about vaccines and promote a more just and equitable healthcare system for all.